Breast cancer surgery differs a lot in the last decade. And though we have many mastectomies in the previous time, taking out all the breast tissue and all the armpit tissue, we are very seldom doing these kinds of surgeries nowadays. So, breast cancer can be curable, can be treatable while we are conserving the breast. If you find a lump in your breast, this doesn't mean that it must be 100% breast cancer. As the lumps, approximately 3/3 of those lumps are benign, which we call benign. It is not cancer. But if you experience such a thing, you must absolutely consult a physician, if possible, a breast surgeon. And this lump must be evaluated with clinical breast examination and also with radiological investigations. According to age, we can have breast ultrasonography, mammography, breast MRI, and other detailed investigations. And according to the results of those investigations, your physicians can need a tissue diagnosis. Ultrasonographers can make a needle puncture to the breast lump and take some sample of tissue, and pathologists under the microscope can diagnose if it is cancer or not. And if you have been eventually diagnosed with breast cancer, this does not mean that it is the end of the story. In 2014, we know that breast cancer is treatable. The only thing is just to really believing that it may be treatable and trusting the physicians that you have been in touch with. And after the diagnosis of breast cancer, the first thing that must be done is to screen the body. If the disease is localized to the breast tissue or if there is any evidence of spread into the distant organs like lungs, livers, or bones. And if you're lucky and if the disease is confined to the breast, you must be evaluated with multidisciplinary team to find the proper sequence for your treatments. And for localized breast cancer therapy, usually start with surgery, which we really focus on. And breast cancer surgery can be divided into two. One part to the breast, the other part is to the armpit, which we call axilla. 1960s, 70s, we all make mastectomies. But now, approximately 75-80% of the patients, we can conserve the breast, which means that we only excise the tumoral tissue with the surrounding healthy breast tissue. And this is the old treatment for the breast side. And for armpit, we have new innovative techniques which we call sentinel lymph node biopsy. With the aid of nuclear medicine, just in the surgery, we find the very first lymph node in the armpit, the gatekeeper lymph node. And we excise it and send to pathology while we are in the surgery. If the pathologists say that there is no spread of tumor, there is no evidence of tumoral cells in this lymph node, then we can approximately 100% understand that the disease did not spread to armpit. And this necessitates to preserve the armpit lymph nodes. If the pathologists say that there is some evidence of the disease in the very first lymph node, then we can appreciate the fact that if the tumor goes to the very first lymph node, it may go to the deeper levels. Because of it, we excise all the armpit lymph nodes, which we call axillary dissection. So you can conserve the breast and you can also conserve the armpit lymph nodes according to the stage of your disease.